Okay, so I'm gonna kind of be up in the space here of the video. I like to grab some type of stimuli. I'm just using a marker because that's what I have right now. But you really want one that has a difference in contrast, and it's always good to be like, hey, can you see this? Because maybe the stimuli is too small. Maybe this one's okay, like because it's thicker, because it's different color. That is helpful if somebody needs to have a larger size. So the first one we're gonna do is we're gonna do visual tracking. And so I have my stimuli about midline. It's weird doing this on a video. So at about midline, and then I'm just gonna tell them to keep their eyes on the top of my marker, whatever, and just follow it with your eyes. There you go. We're gonna go across this way and come back. A lot of times I'll let people blink because there can be eye fatigue, especially if you're dealing with somebody who just experienced some type of traumatic event. Their body needs more time to recover from different types of exercises, eyes, body, just moving. Okay, so now we're gonna go vertical plane. So we're gonna go up and we're gonna go down. Give a little break. We're gonna come here again and we're gonna go into our corners now. Here and back. Down and back. Woo! I need a break. So I'm looking at their ability to, one, keep their eyes on the stimuli. So sometimes I'll be working with someone and they're following it and then they have to come back to the center and then come back. Okay, then we'll start over. Come back. That. Okay, so am I blinking a lot? Is it hard for me to stay focused and have a stable gaze on what I'm looking at? You know, I'm making facial expressions like, ooh, maybe it's blurry, or like, whoa, I can't really see that. And ask the person how they feel or what they noticed. I mentioned this before, but your clients know their experience best. And so as applicable, trust their judgment and really take what they're saying into calculations. Another thing we're gonna look at here is, again, compensatory movements. So if I'm moving with my eyes, am I also moving with my head? Am I able, or my trunk, honestly? Am I able to dissociate those movements? Or again, am I squinting? Oh, okay, over here, now I'm squinting. Or sometimes when I'm doing a visual tracking activity, they'll look at it and we're going this way and we're looking at it and then we get here and we stop. What does that tell us? Like, can you see it? Yes. Can you see it now? No. Okay, let me know when you can see it. Okay, I see it, and then they're tracking to the side. So that can right off the bat give us an indication of, they might have a field cut. And then you can do further visual field testing to identify if that might be the case.